Hi, welcome to Piddington Roman Villa Museum's website. I'm Martin Weaver. I do facial reconstruction. If you come to the museum, you'll see a reconstruction of mine there of a young girl that we call Pidda. And I'm going to show you in this video how we get to the end product. So, we've dug up a skeleton that we've found at our dig site. It's been cleaned, examined by a osteoarchaeologist, and a report has been made. And from this report, obviously, we know the sex of the person, the rough date when he or she died, and the period we're looking at. Also, any factors that would affect the face we need to know, such as any illness or injury, sword fight or something that may affect the face. So we need to know that. Once we've got the skull, we need to make a copy of it. We obviously don't work on the original skull. We make a copy from plaster like this one. Or we'll have it 3D scanned and print a skull in plastic, which is a great non-invasive method of working these days with archaeological skulls, which are very delicate and usually come in many pieces and take weeks to put back together, so that we can actually use it for a facial reconstruction. So once we've got that, I personally like to draw the skull to scale, and on that drawing I will put all the measurements that I need to refer to whilst I'm doing the reconstruction, such as the spacing for the eyeballs, the width of the eye sockets, the height of the eye sockets, and I'll sketch the general shape of the eye socket because that's very important with the eyebrows that are going to go on and things like that. Also, I need to look at the nose, the width of the nasal cavity, the length of the nose, the teeth as well. We need to look at whether the skull has, when the jaw is fitted, whether it has an overbite like this one, where the top teeth overlap the bottom teeth, or the other way round, an underbite, which is like so. And most importantly, if it's got a straight bite, which very few people have these days. Most people have an overbite. We'll also look at the mastoid process, which are the chewing muscles, mastication, because the skull attachments of the muscles will give an idea of how big those muscles were, and that obviously affects the overall look of the face in the width of the cheeks and everything. And also this zygomatic process here, which this arch here, this is most important to log, because this is where your face basically hangs from in a visual sense. So once we've got all that, and we know the ethnic origin of the person roughly, either by, if we're lucky, having DNA evidence, or stable isotope analysis taken from the dentine in the teeth, which can tell us the origin of the person, and tells us a lot of information. If we've got those, great. If we haven't, then we can examine the skull carefully and look from the three main skull types, which are dolichocephalic, which is the Northern European type with a thin face and pointy features, or mesocephalic, which is slightly wider version of that with more rounded features, or a brachycephalic, which is the wide face sort of Mediterranean, or maybe Viking or Germanic type skull types. So those are the three main groups, but very often they come within those groups. There's lots of different variations of ethnicity. So we will take a view of that and come up with the facial type. We will then consult our data depth charts, and we have charts for all races and male, female, different ages, different statures, body types, and we have data sets for all this. And this is a standardized set of data pegs that are attached to the skull. At standard, as I say, it's standardized, and this gives us where the skin actually would come to, the surface of the skin all around the face. But first, well, we'll attach those. We'll cut them to the size as per on the data chart for the skull we're working on. Or if we've noticed any differences in the skull from the standard, we would factor that in with the data pegs in that area. It's like if it was a very extremely fat-faced person, for instance, we would make sure that we'd factored that in. Once these are fitted, we would add the underlying bits of the face, such as the muscles, the glands, and fatty deposits. And when we reproduce the faces, they're always usually done with the face at rest, and that's when every muscle in our face is relaxed, and they're a squidgy sort of mess. You'll see a lot of reconstructions where they've actually modelled the entire musculature of the face with all the different muscles clearly visible, and there is actually no point in doing this. It looked great on your progress charts for your customer, but in actual fact, when the the face is relaxed, everything blends together into a squidgy mass. So it's really no point in doing that, because we don't know how big each individual muscle is, so there's no point in rendering them at all. We still do it though, as you see on computerized reconstructions, that they still tend to put the facial muscles in. Why? I don't know. It just looks good, I guess. So anyway, we do that, and we put the this mass in within 4 millimeters of the end of the data peg, and 4 millimeters is the average depth of the dermis and epidermal layers of your skin. And we put this, well, I put this on first because I don't want to go straight to the edge of the pegs, because you can end up with some very strange angles of the face. If you add it up in layers, you can actually control how it's going, and you don't get strange angles. We found this when I was teaching this subject as students. We tried the American system, which does go straight to the edge of the data pegs, and we found that we got lots of funny angles on the face. And once you've got that, it's very hard to know where you're going. So building it up carefully like this is a good way to get it accurate. And you can actually see if you've got any lumps and bumps, and you can take them out. Then once we've got to that, we can apply 4 millimeters of clay to that surface, and the clay is rolled out. We have it's 4 millimeters thick, as I said, and we apply it in strips to the face like this, and you end up with that. So that's a finished product, and what I'm going to talk about next is how we determine the soft tissue areas of the face, which is the real crux of facial reconstruction. because the science takes us as far as the data pegs, but it's down to our own interpretation of what we see in the skull that provides the features. So how do we start? So we know what the eyeball spacing is because we've measured from the skull. So we know that the human eyeball is roughly 24 millimeters in diameter. So we can model that. I make my own eyeballs like this one has, in a range of colours to use. They can be added in straight away. So that goes into the, and of course remember now that it's all fleshed out, but these areas haven't been completed. We've left a gap where the lips will be. So working on the eyes and eyebrows, we know that the eye fits from the width of the actual eyelids goes from the inner to the outer surface of the orbit here. So we have to use that measurement, and we form the eyes that way. The eyelashes, sorry, the eyebrows, I should say, follow the supraorbital ridge here, and that gives us the type, the slant of the eyebrow. So that's how we work that out. The nose is quite an interesting one. We take the bridge of the nose here, and the width of the nose without the nostrils is exactly that width across the aperture here. So we follow it basically. The nose is obviously made out of cartilage and bits of soft tissue, etc. So we model that carefully, because this obviously doesn't survive in the with the skull, the remains. So we model that, and if we take this little ramp inside the nose and we extrapolate outwards from there and downwards a few degrees, just a couple of degrees down from there, this gives you where these 2 points match the tip of the nose. Again, I would draw that onto my plan of the skull, so I know exactly how far the nose would come out. And the type of nose is, as I say, it's following the shape of this, between this this shape here and the angle of the nose there. So once we've got that, we move on to the lips. So how do we work out how this person's mouth was? Well, first off, these are rules of thumb, and it varies with each ethnic origin and the way the bite is. But we measure the tooth from the enamel part of the tooth, which starts to about there, with the jaws together to there. That is the total width of the lips, from there to there. That's what you get from there. And then how do we know how wide the mouth is? Well, it's the first 6 teeth along the top. We extrapolate outwards from here. Hope you can see that okay. And at the angle of the jawline, we take out, and where that point meets, that is our, up to the data peg, which is here and here, we can see how thick the lips are from that. And that's a rough guide. As I say, it depends on ethnicity, age and everything else. So we've got that, and we will model that. And you can see here, this is actually, this cast is the same as this finished product of this cast. This isn't finished because on an archaeological sense, this would be obviously coloured in skin colour, skin tone. This was done for forensic use. We were doing a study on if it was easier to recognise somebody by just having a blank coloured finished product, rather than one that was coloured, and maybe you've got the skin colour wrong, or maybe the eyelashes are a different colour, or the eyes are a slightly different colour, hair's wrong. Would that affect the recognition of a person in a forensic sense for the police? And we found that it did. And so but that's why I did this one. So this one will be finished ultimately properly, and we'll have proper hair. We use wigs and things like that, and we use eyelashes, and they're all put in individually. It's quite a long job. It takes about 2 weeks to do a facial reconstruction. That's working an 8-hour day. So we got the lips all modelled. The nose is modelled from the bridge of the nose. Information we got there. Eyes are in. Eyebrows are done. Now we come to ears. Now there is absolutely no information on ears at all in the skull. They seem to be completely random and individual. So we have things called ear frames that I made up, and it's like a plastic frame that you can quickly make an ear on. Ears are quite tricky to do, and I found my students were always troubled with ears. Very, very difficult things to model. So I made ear frames, and you just press a bit of clay into this pre-made mould, and it makes an ear that you can customise to the size of the skull. All we know about the ears is they tend to follow this jawline here. The angle of the ear tends to sort of follow that. A lot of facial reconstruction people like to use hair that covers the ears, because that is the part of the reconstruction that we don't really know about from the skeletal remains. So that's it really. That's how we do it. I use acrylic paint for the skin tones, carefully mixed up. Yeah, and it's like an artist. Once the data pegs have finished, it's all down to art really, and really what that you've built up over a period of time working in this field. It's a fascinating field to work in. I've been at it now sort of 18 years, I think. So anyway, hope you enjoyed this video. Please come to the museum, and yeah, thanks a lot. Bye.